Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
Yes,
Stand right here.
you can just sit, right?
Yes,
Sit.
Yeah.
sure. Okay, what can I do for you?
Very poor range of motion in the knees, but I'm getting some discomfort with the left knee.
Do you mean the right knee? Because you're holding.
I'm sorry, the right knee. Make that the right knee.
Just saying here.
They were both scoped. The right one in 1990 and the left one in 2005. Meniscus tears, and they aspirated them a couple times, and the fluid came back. So they said, "Well, we got to go in." You weren't around.
Okay, which knee bothers you the most?
This one, the right one.
And does it, you get any heat on it?
Yes, I take an Epsom tub every other day, and the heat helps it a lot.
No, I mean, does it, are they hot
Oh, no.
when you touch them?
No.
Okay, and you have trouble climbing steps?
Yes, as well as going down too. The strength factor there, it's just not there.
Well, it's a pain, that's why. There's no weakness there, it's just painful.
It's sort of from here to here.
Right, it's pain. That's where you have to look at it. Weakness would mean a nerve weakness or a muscle disease.
Okay.
You don't have any of that.
All right.
What you have is pain.
Right.
So,
Right.
so in other words, if we take the pain out, you don't have any problem, right?
No problem, except I was hoping, you being a ligament and tendon man, I was
That's what it
hoping you
is.
could tell me how to get my range of motion back.
Well, we have to get it back for you.
Okay.
So how long has this been bothering you?
I'd say about 3 months, really. They were both pretty
More than
equal.
that.
Well, they were both equal for a long time, but I've got to get after this thing now. I can't let it get any
It's been
worse.
years,
you know?
right? Because you've had,
Oh yeah, yeah,
you had work on them for.
yeah. But there was really no pain per se. But it feels like there's fiber in there. You know, like it's just restricting the range of motion. I don't know if there's scar tissue in there because of the surgeries or not, but.
Well, there was scar tissue before the surgery.
I guess that's always possible.
Has to be, and they really don't examine these things. They just want to do scope or surgery on this. All right, so let's see. Does your hips bother you?
No,
Or your lower back?
no.
Okay. Now let's see. That is a knee. It's almost coming out. I mean, it's almost. Where did they go in at? Here, here, here?
It was a 3-chamber deal. There was
3-chamber?
one there. That's what they call it for the clean out.
I heard that. The clean out.
Well,
Clean out.
he went into three different places.
Don't tell me who it was.
Okay. You probably know the first guy.
I don't want to know.
Okay. Had a surgery at St. Mary's Hospital.
I'd like to close those places down. This one is worse.
Really?
Yeah.
But I don't have the pain yet. It's probably coming.
This is almost straight, so you've lost a little extension.
Okay.
But this one, you've lost a lot of extension. should be out here.
Right.
It's at least 15 degrees. But they're not hot at all, and no fluid.
Okay.
So what that means is, excuse me, what that means is that there's a scar tissue behind. So it's a functional problem,
Okay.
not a disease problem.
All right.
In other words, there's nothing to operate here.
Okay.
They're normal knees. They're both normal, except for this capsule right here.
Right.
That's what's holding it in extension, so it won't come straight.
Okay.
Therefore, you have to bear weight in the front. That's why you have pain.
My other question is, I used to be able to sit on my heels. No way, you know, 90 degrees is it now? They won't go back any further than that.
Well, I don't blame them. That's really bad.
Well, it's a position that I wouldn't get into at my age necessarily, but I was in a yoga class for a couple of years and I found out how little range of motion my knees had. I couldn't do most of the leg exercises that involved knees, so I was hoping we could.
All right, so far you have a posterior knee capsulitis.
Okay.
That's your diagnosis. And functionally, you're using the front of your knees, which you shouldn't do. It's patellar pain.
Okay.
The patella pain is always secondary to something, so usually it is. So in this case, we have to figure out, what about your hip here? Oh, here's another problem.
Hip flexors are tight.
Not the hip flexor,
Okay.
it's a capsule.
Okay.
Look. And see, that is almost normal. This thing doesn't come up at all. See?
Okay.
Yeah, so not only do you have a bad knee on the left, but you have a bad hip on the right.
Really?
Yeah.
Okay.
And because of that knee not straightening out, you've sacrificed the function of the right hip, which will affect this knee.
Okay.
So left knee is the worst, and then right hip. And you have no back pain then?
No, sir.
All right. Is this all new to you?
Well, I try to go outside in the mornings and I'm doing a lot of bending over and picking up exercises. So after about an hour and a half of that, I get some, it gets tired. It gets
What?
pretty
Back? Your lower back?
Yeah, lower back gets tired back there. But like I say, if I take an Epsom tub or something like that, the heat really helps a lot.
Yeah. Well, what that is you have a ligament pain.
Okay.
And when you put heat on it, it expands, so you don't pull on it.
Right.
Once you take the heat away, it contracts, so now
Right.
you feel it again.
It's good for a couple hours and then it all goes back to where it was.
That's exactly right, and that's what happens.
Okay.
So, the film that we would ordinarily do for this, for your back and hip, is going to be pretty useless right now because your knee is so contracted. You can't stand straight.
Okay.
Do you want all this treated?
Let's start the process.
What insurance do you have?
Medicare.
Well, that takes care of it.
Really?
Yeah.
Okay. Well, I didn't bring my cards today because you said on the radio program that you get into problems with insurance companies and this
No,
and that.
it's only the lower back.
Okay.
It's a spine thing. They've got it in their heads that they have to cut the cost down for spines.
I see.
Little do they know, there's only 2 structures in there. That's what I talk about. There's 2 structures in there. What do you want us to do with it?
Right.
You don't want to pay for that? What are you paying for then? You know,
Right.
I mean, it's just
Right.
it's craziness. Like they'll pay for an epidural, which doesn't do anything, but they won't pay for something else. I mean, you can't believe these people. I mean, I keep
believe
saying,
it.
who the hell are you guys? You know? Why don't you come here and talk to me? You're no experts, I'm the expert.
Right.
Okay, so anyway, these are all shots. And we use a fluoroscope to see the ligament back there, which you can see. And then we put a shot in that and it'll come apart. And it takes more than one though, because
Okay,
that's a tough ligament. Don't forget that ligament there
for a long time.
is holding up your whole body for
Okay.
a long time.
All right.
Blue around the knee
Yep.
on the left. Where are you looking?
Way over there, far left.
Oh, I'm sorry.
No, go. No.
Right here.
No.
Go to the left.
Oh, okay, all right.
You see the blue around there?
Yes.
That's where the pain is.
Okay.
It's a ligament around it. That's why going into your knee doing a scope is stupid, because there's nothing inside. It's all outside.
And that's something.
Yeah,
I could have saved myself those 2 operations.
absolutely. I mean, these guys are just running wild, and you know what? Nobody knows what they do. That's the biggest problem. They don't tell anybody. They just give you a stupid diagnosis like that.
They get paid all the time, though.
And the
don't they?
doctors don't know what to say. They go, okay. And this. Okay, lay right down. Just right in there. Way away from it. Sir. Feel that?
Yeah.
Good. You're supposed to feel it. It's a ligament in there. It's so tough. This is
Don't
your
agree
hip.
to me. Okay.
Well, this is your hip. It's round.
All right, okay.
But you see there's a space around it.
Yeah,
But then when you get here, there's no space. And it's black right there.
okay.
This is pieces the needle. I should have
It's like an interference fit there, sort of.
Well, it's scar tissue.
Okay, all
It
right.
won't move.
Right.
And that affects your gait. You ever see people, you see them, they're using walkers and things.
Yeah.
It's because their hips are not moving.
Okay.
So they have short steps, so they're out of balance. So they do
Right.
that. That's what you were doing. So anyway, that's going to come apart, and it's going to take care of it. Now, it might require another one because you're so big.
Okay.
It's a big thing.
All right.
Okay. You want to do the knee now? All right, stand up. Oh, what's this big scar from?
Shot myself.
You shot yourself.
Yeah, accident. Back in the quick draw days.
I was going to say you can't commit suicide down there.
There was a little hole there, 357 Magnum of all things. It went down through and it bounced out there on this side right here.
No
And
kidding.
he opened it up because they were afraid I was going to get gas gangrene or something. So I didn't get it, but I just missed the ankle joint. So
What year was that?
60.
Well, they had antibiotics. Which knee are we looking at? This one here, isn't it?
It's the right one.
The left one is the worst.
He said it was the right.
But the pain is in the right one.
I don't care. I'm doing the left.
Okay, whatever.
Whatever.
I'm going after the left. That's a good way. See, the right one comes out pretty good,
Okay.
and the left one didn't. Remember, right
You're
hip,
talking about as far as straightening it goes.
I mean,
Yeah.
range of motion.
Right.
Right hip, left knee.
Okay.
And there's your knee. It's not bad at all. This is going to come out really fast. I'm impressed for you. That was so bad, it was contracted like 12, 15 degrees.
Okay,
And the left, and the right one wasn't so bad.
all right.
But it doesn't look bad. See, you got nice space in here.
Okay.
This is the information right here, black.
All right.
So you're going to do really good. Just keep at this, and you'll do fine. Have any questions about it?
When do you want to see me next?
3 or 4 days.
Really?
Yeah.
Okay. Yeah, they both feel about the same. They're feeling good.
Keep walking. I don't know if you got the
He's walking better.
walking before.
Yes, I did. Yeah, yeah.
Well, this is a good comparison to use on it.
He's very stiff and rigid
Yeah,
before.
nobody does it this quick. Wherever you would go, they'd have therapy and all kinds of stuff.
Oh, yeah, right.
You'd never get over it.
Right.
Here, you're bam, bam, really
Well,
fast.
that's the problem I had with chiropractors.
Oh,
They got you on a rubber band. They'll never let you. You got to keep coming back. You know.
no, it's useless. Chiropractic, they have no program for this. Look at that.
With enthusiasm,
He's not
too.
bent over like he was. Take a long stride. That's it. Way, 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 way. Big, big, big.
Bigger.
Go ahead, yeah.
Bigger. Okay.
That's a stretch out there.
I'm not so sure I could do that when I came in here.
No, you couldn't.
Doing it now, though.
You're getting the motion of the hip.
Well-
Have a seat in
Well,
there.
my knees are
Now it is.
The knees were secondary.
okay.
So
It's really the hip.
Yeah, really, yeah. Have a seat. How long ago did we inject this?
4 minutes ago,
Like
if
4
that.
minutes, 3 minutes, 4 minutes is all. And it's already coming up, right? See, that's easy. And this is coming up a little bit better. Almost equal to that side, not quite as equal, but did you feel that?
Well,
It's improved, isn't it? The range of
yeah,
motion?
yeah, I think so. I think so.
All right, that's how fast we got it. No messing around.
All right, this is great.
No script.
All right. My son has had for about 3 or 4 weeks. He's wearing not a big ace bandage, but it's a wrap here, you know, a compression wrap sort of. He's got something in there.
Yeah, that comes out in one day.
Does it?
Yeah, just
Okay.
to show.
Okay.
Yeah, compression wrap's not the thing to do. You get worse and worse with that.
Really?
Yeah.
Get your son in here.
Hmm?
Get your son to come.
Yeah, yeah. But, I mean, they both feel great now. A lot better than when I came in here and I can stand up straighter. But I never had, in 1,000 years, thought that the hip would be involved, but that's what doctors are for. Good doctors.
Yeah, oh, this goes all the way down?
Yeah, the main part is right here,
And
and it kind of comes and goes from
And
here.
your hands.
My hand, it just sometimes feels a little, like a little tingle. And it happened while I was making the kids lunch. But just in my neck then, and then throughout the day it started hurting, and
What were you serving in it?
I was just making
Steel
sandwiches.
anvil? Or maybe you were still...
And all of a sudden I felt a pain, you know,
Yeah, when was that?
4 days ago on Tuesday.
Were you lifting before that?
No, I had just gotten up just a little bit before that.
Well, it's whatever you did the day before that.
Day before that? No, that was years ago.
Peanut butter and sandwich, that was it. Peanut butter and jelly, that was
It's
it.
Yeah.
the peanut butter. It's
Very
trying to get
heavy.
out of the jar.
It was a cheese and teriyaki chicken sandwich, actually.
Wow, that's a nice lunch for you three. Okay. It goes down to your right hand. Which part?
Just sometimes just feels a little tingly, you
I-
know,
okay,
like
I
a
wanna
little.
know where is it?
It doesn't hurt. It just I feel
It's a
tingling.
long finger, long
Mhm.
finger?
Mhm.
Oh, and what about your arm? Where does this pain go in your arm?
It's more at the top of my shoulder, behind my
Does it go
scapula.
down here? Or
It
under,
doesn't really.
under your scapula?
I just mostly feel it right through here.
Okay, how about under your scapula or
Mhm.
to it? Does it go under it or to
Under
it?
it, yeah. I thought
Under
I
it.
said yeah. I'm sorry.
The inferior, did you have an x-ray for this?
No, I haven't seen anybody. My husband, this morning when I got up, said he'd been listening to you. Well, he said something yesterday about listening to you on the radio, and then asked me to
Yeah.
come here. Everybody else, for the past several days that would see me, would say, go to the chiropractor, but I
Oh,
just
good.
can't go. They scare me.
All right, no treatments and no x-rays, right?
Mm-mm.
Okay. Wakes you up at night?
Yeah, I'm having really, I can't sleep, I can't get comfortable. I'm a tummy sleeper, so I go to sleep for a few hours and I'm awake. I've had a lot of Motrin. I've treated myself with Motrin, heat, ice the first couple of days, and I went to heat, Motrin around the clock, Tylenol. That's it.
Aspirin's your best drug.
Yeah, I was just throwing something in there to help me out.
It's the best anti-inflammatory. All right, so we gotta find out where this is. So
Mhm.
it may be a double. See, under here, can't really come from your neck. Does this bother you in here?
I think I'm,
Nothing
no,
here? Okay, chin down.
no.
We're looking for a pain. Just tell me where it hurts when you do it. Tell me right or left.
Right side.
All right, so I gotta go about 20 degrees. And chin all the way back, up. You can't do it now. And where does that bother you? On the right side, right here again.
Mm-hmm.
And chin on your right shoulder if you can.
Oh.
That's nice. Go this way.
Oh, it put a sharp pain right.
Okay. Go this way. Does that hurt on the right?
Mm-hmm.
All right, now. Let's see here.
Oh.
Oh, you're hot.
I know it is. I think because I'm
How does
hurting.
that feel? This one, or this one,
That one.
or this one? This one?
Mm-hmm.
That one. Now this corresponds with the hand symptom and the back of the arm, and I don't know about the under of the shoulder blade, that may be something else. Anyway, it's a C67. All right, let's take a picture of this, then I'll take this pain out. You want me to take this pain out first? It's 2 shots.
Oh, I'm scared of the shots.
Yeah, okay, that's okay. I don't care if you're afraid or not. They're good.
I'm not sure.
You want this pain out of there?
I do.
Okay, takes 2 shots.
2 shots. Oh my god. I told him I didn't want to be a baby on camera.
You won't.
Do I have to get up?
Well, you have to say yes or no.
What
And
can
then go for it. I'll give you a chance. I'm going to take a picture of your neck standing up. This metal will just pull it. So actually, it's the 5/6 is causing all this trouble.
Wow.
So the 5/6 is like fused, old injury. 6/7 is wide open. That's where the symptoms are. Oh, there you are. Come on. The under your shoulder blade comes from here. This one. 1, 2, 3, 4. T3, 4. It goes straight. Like that.
Mm-hmm.
All right, now your neck. Your neck is still too dark, but you can see it here. The 765. This one has been damaged and scarred down. Your symptoms are from this one. So 67.
Mm-hmm.
56 is the one that was damaged. See the scar tissue there?
Yeah.
All that white, there's no space there. That's all ligament repair, injury. So that's been years ago.
Mm-hmm.
Right?
I don't know. I didn't know I had any problems.
Oh yeah, you had an accident. There's the evidence. Whether you know it or not, there's the evidence. Anyway, shall we go ahead and do this?
I guess so.
Yeah.
I still don't know what we're doing, but I'm kind of. I think he doesn't seem like he has full-on scoliosis, but he seems uneven.
Yeah, well, we can help them. Okay, lay on your either side, because you're going to get 2 shots on each side.
I'm so scared.
Oh, they're very fast.
Quit videotaping me for just a minute.
You got some relief?
Mm-hmm.
It's great.
You want to go dancing?
I just queasy. I think from no sleep and so much Motrin and.
Oh, this is
Just so
anxiety.
tired.
You can lay down again if you want, but if you get up.
No, I'm okay.
Oh, okay.
The thing is that for most people, it's for years they've been doing something, a subtle thing that they don't know, that has repositioned their spine a certain way, and they don't notice, okay? And all of a sudden they could be making a peanut butter and jelly sandwich, something insignificant.
I definitely feel a difference.
All right. Is your neck involved? Let me see. Let's go ahead and put your chin down. That's good. Chin all the way up. That's good. All right. It's not your neck.
No, it's right in here.
It's down in there.
Yeah.
Okay. Let's take this off. You want me to shoot that out?
Yeah.
A couple shots. We're going to have to rename this room. The OK Corral. How would that be? Let me see. Let's see. That's a 6-7. That's the base of your neck, and it should be this one.
Yeah, right,
Or
where
this
his
one.
finger is, right in there.
Yeah, right there. Okay. That's it. Right there?
Yeah.
All right. T12. Have a seat.
Now,
We get it right?
yeah, and hopefully,
Yeah, well, you know.
that's it. What about the back?
What about it?
No, it's, the lower back is still a little bit,
Lower back?
yeah. The last time you gave me, 3-4 months ago, you gave me a shot in the,
What the lower back, though?
right in here, right?
It was T1011 up here. And you're wearing that 3/8?
The lift?
Yeah.
Yes.
Well, that'll keep your back in good shape. One pinch. Oh, your ligaments are tough. I'm ruining my hand doing this. You're not even bleeding. It's good. There you are.
I'm gonna be sitting in the car for next few days, a week. So I said, nah, let me do something, because this is ridiculous.
Oh, listen, having a pain is ridiculous.
Yeah.
That's true. Especially here, you don't need to have a pain to know where
No.
it is. There you go, good as new.
Okay, sir. It does feel better, the neck ache.
Already, yeah.
Yeah. Now it's, the back has been around for quite a while, and well, Louis Biazzi was the one that
Oh,
told me.
look, how's he doing?
He's up in Plymouth.
Oh, he's in Plymouth.
Plymouth. He's up there for the summer. In fact, we'll probably see him.
That's pretty nice. He has a business and he goes
Yeah.
up there.
Hey, He's 78, what, 76
He
years old?
doesn't care anymore.
Yeah.
All right, glad to see you.
Yeah.
And you had a curvature, you know.
Yeah.
That was producing the pain in the lower back and between the shoulder blades, all of it. Because once you get a curve down here, it's going to go up into your neck even. So we just chased it all. We corrected the curve, and you've been feeling pretty good, and you're active.
Yeah, oh yeah. The back is pretty good, and I overdo it at times, and then I start feeling it.
Well, this one here is from the painting.
Yeah, well,
You can see how your back would be up like that painting, you know. And I painted a lot, and I know it's just...
hopefully this will take care of it.
But we examined his neck, and it was not from the neck, so it had to be lower. And then you kind of piece it together, the activity that could have produced this. So that's why you ask him, how did you get it? You know? So this is how we do this musculoskeletal.
Very good.
All right,
All
I
right.
see you.
Yes, thank you. And it does feel better, and hopefully it'll get much better.
Well, this is our second visit for ringing in the ears. Now, in the matter of teaching, there's two sides to this. We always try to pick the worst side, and then on the second visit, we do the other side. And these are shots. And so how did you do with the first, which was yesterday?
Yesterday. Seemed to be better on this side, yeah.
The left side. So on the workup, the right side was actually worse on the film. We did the left side because it was symptomatic. Okay. All right. So let's go ahead and do that. Have a seat right there, and we'll do it for you.
Feel like a pin cushion. I just got these hearing aids. Cost me $4,000. You know how they wanted to treat the tinnitus? You can add a background music, like a waves breaking. You know, and their theory is that you concentrate on that sound rather than this sound. And I said, Christ, that's aggravating. You know, they're both aggravating. But it does amplify.
Yeah, they wanted to do what? Their
They can
idea.
add music, background music.
Is that right?
Yeah.
Oh, blood. Background music, huh? To do
Yeah.
what? Distract you.
You're supposed to, their theory is that if you concentrate on that, like a waves breaking, you know, or birds singing, you know.
Yeah, that tells you how ridiculous these guys are. These are ENT doctors, the specialists, and they have no clue on what this is. None.
I'm in
There's
Peoria,
nothing.
Colorado.
They have to separate the hearing from the noise. It's not the same thing. The noise is what we can treat. And of course, we did the research on that, but
But you did test my hearing, though. My hearing, I had low, you know.
that's okay. That has nothing
Loss.
to do with this.
No, well, but that's the reason for the hearing aids, you know, to amplify those low sounds.
No, that's fine.
Yeah,
That's
yeah.
we have nothing to offer for that.
Yeah,
It's a nerve damage, and there's nothing I can do for that.
yeah.
But ligament stuff that we can do something for them.
See, they don't know that.
They don't know that, no, and they're not asking to either.
No. Well,
When you got 3 million people listening to that on Sunday, you'd think somebody would call me up and challenge me, but they don't. Whatever they know, and they do it, keep doing it. They don't call up and say, "Are you serious about this?"
whatever's bringing the money in, that's what they.
It's not the money; it's what they know. You know, if you were a bricklayer and somebody told you to build this a lean-to with wood, you'd say, I can't do it because I'm a bricklayer. That's what they do. This is what they know, and that's
Yeah,
what they do.
they're
It has
special.
nothing to do with money, because you don't have to go there and spend it. See?
No.
So people get the wrong idea that this stuff is done for money. It isn't. It's done because that's what they know. Like for instance, I wouldn't do anything that had to do with getting your attention away from this noise using music. I think that, because I know how to do it, so we do it. We don't mess around with that. So there's a lot of things out there, and people get the wrong idea. Physicians are really high-grade people, and they do what they know to do, what they've been taught and what they think, and what the results they get. And sometimes they're not good, but they do it anyway because that's all there is. And they go to the courses, and who teaches them? ENT guys who don't know anything either. And that's what they come away with. And they say, well, that's what they said.
Well, you
so
can't say they don't know anything, it's just they
teach what they know.
They teach what they know.
So you come away doing what you know to do. And and I keep telling people on my radio shows that don't keep going to those people. If they can't fix you in one day, don't go back. Don't be crazy. Who knows? Because they could be saying about me, oh, you just wants the money. Listen, I have more money I can ever spend. You know, it's not the idea. The idea is do good work and you get more money. That's how you get it. Anyway, how's it feel? We're just jabber-jabbering and waiting a couple minutes for this.
I mean, my neck felt good all the way up, you know.
How about the zing-zing?
You know, it's hard to
Differentiate?
Well, what he's describing is...
whether it's memory or...
Yeah, when you have a symptom like this, you have a memory of it, and pretty soon it's going to be gone because
And you don't know.
you're having a question about it right now, which means that that's going to be working on that. All right.
Actually,
Now, notice that he had to move his head to get the sound. So it
no, I'm
tells you-
trying to find the sound, you know.
Yes, that tells you. See, what I'm looking at as a clinician, that tells me that it's based on something in the neck, and he has to move his neck. And when you move your neck, you're not doing anything to the ear, hearing mechanism. So that's observation. The same thing, throw in autism, same thing. Those kids have bad neck because I'm observing them and they don't know what to do with their neck. But it's in the hands of other people, and that they just don't ask because they're all doing what they know. All right, what do you think?
Time will tell.
Yeah. You can wait around.
Yeah.
All right.
Okay, so I noticed like my head, since we did everything, I can have good range of motion here. When I turn here, that one spot right there, right in here, is super tight and it keeps me from turning my head to the side. And then something in here is just still super angry, right? Like if I push right here, it's just super angry, right there.
Angry?
Angry.
Angry.
You don't like my words.
No.
So,
Let's see. Well, we know about what you're talking about. That's a joint there,
right,
and we didn't touch it yet,
okay,
so we could do it now.
okay. And then, like I said, that T-spine, right? Can I show you? Like right in here,
Ooh, how nice!
right
I
in
like
there.
that.
I have strong fingers. I've been told I have strong fingers.
Where's
right
the button?
in, like if I, where do you want me to sit? Crouch,
No,
sit,
stand up.
stand.
Yeah, stand up.
Okay.
2,
No, like
7, 8.
it's right in
Should be right
between.
here. This is 1. Yeah. This
And then if you go up just a little bit on the,
well, this is 1, 2. This
Yes,
is
sir.
going to be.
and then right in between like my scapula,
Yeah,
it always
we
feels like
already
it has
showed
to
you that
pop.
one.
Yeah.
Which one do you want?
I feel like we probably need to take care of this first,
We will take care of your neck today.
and then whatever else you think is gonna help me
get on the right track for that T-spine, whatever's the most important.
We already did the T1, 2. It has to be a T2, 3.
Because this, whatever this issue is right here,
Yeah, we
just
don't,
doesn't want to quit.
We don't repeat treatments because we don't need to. These are cures in themselves. Every time we do a treatment for a particular problem, it is gone.
Yes, and I think what's happening is since those areas are gone, completely gone, now I'm starting to notice where the other trouble areas
That's
are.
right, and that's exactly
Yes,
what
sir.
we want.
Yep.
So we can chase them all out of there.
Perfect.
And they're all listed, everything's
Yeah.
listed.
Listen, you're gonna need a new sheet of paper.
I know. Yeah, da 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 da.
That's insane.
What's insane?
So before he injected me, I noticed that my range of motion, as far as my head tilting toward my shoulder, was limited. It's like a rubber band was tight, like it had no give. So now I can stand and I can actually turn my head to the side without manipulating my body to get my head to my shoulder with no pull in this side of my neck. So it's insane. And immediately what felt tight right here is gone. So that ache right there, that achy, angry spot
Is happy now?
is happy, yeah. And so
Cool.
the issue I have with this, bringing my shoulders back, now I can bring them back into like full range of motion with no problem. Usually because of, I guess right here, it would get caught and it would feel like it was gonna spasm. So now I can come back with a full range of motion with no problem. It's magic. Listen, no man makes me sweat like you do.
We got it.
It's a gift.
When you think about me, do I
Oh,
have clothes on or not?
I don't know. So,
Maybe there's something wrong with the air, you know?
no,
It
I don't.
feels clammy in here.
No, it's you.
Oh.
You just make me sweat every time. So, I'm good.
Yeah, you're good. So
Yep.
see you next time.
Yes, sir. And my friend will be back to you. Crazy.
What are you studying in school?
Exercise science. I'm in, just started my master's program at FAU.
Oh. Fascinating.
Mhm.
What town do you live in?
Point Beach.
Forgot to put it down. Yeah, and there's it.
33437.
Sign here. Do you have any lectures on pain?
Sorry, yeah. Pretty good amount. Yeah.
Who does that?
We have Pika. He's one of our main guys that I've seen. I forget his first name, but Dr. Pika.
Is it a doctor?
No, I mean, he has like his PhD, but he's not a
And
doctor.
he tells you about pain?
Yeah, a little bit, but I mean, very general stuff.
Well, yeah, that's what I mean.
Yeah.
Yeah, call me in there. I know about pain, nobody else does. So there you go. Didn't we talk about this before? People are coming out of school, you know, and they're trying to work, therapists of all kinds and massagers and all that. They get no basis of where pain comes from.
Yeah.
I know that. So, and we treat a lot of them too. Well, what do you got there? Neck pain?
Yeah, the lower back, or the lower neck, sorry, just base of the neck. I do jiu-jitsu and
How'd you get it?
it's kind of like wrestling. It's a grappling sport, and I don't remember the exact cause, the movement that caused it, but just after one of my practices, it was really hurting the base of my neck.
Yeah. Is your either arm bothering?
I get a little bit of a kind of radiating pain down in the arm sometimes. Maybe it's not really common, but I'll get a little bit of tingles in the fingers, maybe sometimes.
Well, finger.
Once a week, maybe. Lower 2 fingers, maybe.
You have trouble using your computer?
No, I haven't lost any like motion or anything. I haven't felt anything
You
like
can
that.
sit and do that?
Yeah.
And how old is this pain?
I'd say it's about a month and a half old.
How did you get it, or did you tell me that already?
Yeah, training, wrestling pretty
It's
much.
wrestling.
Yeah.
It's mixed martial arts.
Jiu-jitsu, it's kind of like wrestling, but
Because you have the cauliflower.
yeah, exactly.
Here.
It's like a grappling sport, pretty much.
Okay, you have had any treatments for this?
I went and got an MRI, and I've done a little bit of physical therapy so far, but hasn't really helped too much. Like the pain, the symptoms are pretty much the same.
No, they don't help at all. It's just a waste of time and money. So what did your diagnosis? What's your diagnosis?
They say I have kind of, I guess, like pretty wasted away. Like what do you call it? My discs are degenerated a lot in my lower C5, C6, C7, and just my vertebrae have, like, you could tell it took like a pretty bad trauma, and I think they said the ligament outside of the neck could have been sprained, or it was sprained, according to the MRI.
Well, first of all, the diagnosis is wrong. It's C7T1 and C8. Anyway, and what did your therapy consist of?
I mean, so far it's been a lot more just soft tissue work and stretching it out and getting like full range of motion and just a little bit of strengthening, kind of just pushing against.
Strengthening.
A little bit, yeah. But that's all. It hasn't been too much of it, like attacking to try and strengthen it, just more loosening it, a lot of ice and stim, stuff like that.
Okay, how was it done? By manual? How was it done?
The stretching?
The treatments?
Yeah, manual, pretty much.
Somebody actually pulled it.
Yeah.
What did they pull apart?
They just grabbed like a towel on the back of my neck and just kind of like stretched in different directions.
That's it?
I mean, that was part of the stretching, yeah. Different just like massages in that area. I didn't think it was really working too much. Honestly, I never really felt too much better leaving it.
You're a pretty smart kid. I'm not kidding you.
I have to use my body a lot. I mean, compete jiu-jitsu a lot, so I'm pretty in tune with what makes me feel better or not.
Yeah, their treatments are ineffective. First of all, they don't get a proper diagnosis, and you can't get one from an MRI. That's why they sent you. So I can fix you up. You must be one of their favorite guys around there. All right?
Yeah.
It's a very nice family.
Really nice family.
Yeah. All right, let's put your chin straight down. Okay, where does that hurt you?
Here.
Yeah. Chin all the way back. Where does that hurt you?
Same, just kind of like
Same spot.
the base of
Not
those
very
vertebrae.
back. So you put your chin right here. Good, and that way. And that's good. All right, so there you are. Yeah, we'll have to figure out where this is. Well, this is the 5-6 right here. 6-7, 7-1. If it's not there, it's got to be here. How about that? Mm-hmm.
Yep.
3-1-2.
Yeah, it hurts.
That's
a lot
it,
there.
and that'll go down to your hand.
Mm-hmm.
And we'll take a picture of this, and then there's 2 shots, and that fixes it.
Okay.
Like that?
Yeah, definitely.
Then you can go back to wrestling and get hurt.
They're battle scars.
I'm not kidding. Yeah, that's your neck. The problem you're having is right from here, T110. The rest of it's pretty good, but you got a little arc here. Do you have a headache or anything?
I feel like a little
About the
tension
top
right here
here?
in the bottom of my,
The top of your right side,
yeah, kind of like
or right there.
yeah, a little bit. It just feels tense here usually, kind of
Yeah,
like
well,
as the
that's
day
because of
progresses.
this calcium formation there. 76543. These are all injectable places and they're cures. That's why we figured it out like that. So your basic problem today is right here, and this is a secondary problem up here. And then you don't get migraine or...
Not migraines, but I do get a lot of tension right back here. Sometimes it'll lead to kind of like a dull headache. Not really, I wouldn't call it
Yeah,
migraine,
well,
but
that's because of this,
yeah.
right there. COC1, right? These are all injectable places. They're all just ligaments causing the pain. Once you release the ligament, then there's no pain there.
Okay.
That's what you got to know when in your business. You got to know what relieves the pain.
Mm-hmm.
It's not exercise. But everything else is pretty good. I'm surprised.
So you think the base looks okay, like the C6,
This
C5
is the
area?
big- Yes, this is good. Yeah.
Yeah.
The problem is, by examination is right here. Your 5-6 is not affected. Above that, C4-5 is joint, or C, whatever it is, 7-6-5. 4, yeah, 4-5 and 3-4 on the right. Yep, those are all the targets. If one of those treated, that's how we write them down. So we treat all of these areas because they're all defective on this. I shouldn't say defective, they're just ligament sprains. That's all they are.
Yeah.
Injuries, but they're all correctable. See that? Okay, well, I can take care of this one, the basic one today, and we could do the your COC one up there
Okay.
today.
All right.
Did you eat?
Yes, I did. I had breakfast.
Like what?
Some eggs and some bread, some a bit of granola.
All of that?
That was it. 2 eggs, 2
That's
pieces of
good.
toast.
All right, have a seat right there.
Okay.
And the chest goes on the table, your forehead on your wrists. Okay, very good.
But then when I got into adult, things got a little harder. I've gone up to second though.
Second in the
Yeah,
world.
no, I was a purple belt last year, or 2 years ago. Yeah, I was second in the world, was the highest, I think. But I've been like #1 in the country for, like, I was for like 2 years in a row. Just won nationals and stuff.
That's awesome.
Yeah, it's getting more and more competitive, I feel like, every year.
Are you causing your name to be out there now?
Am I? A little bit, not really. Jiu-jitsu's not that popular yet.
Isn't that what the Gracies did?
Exactly, yeah.
5, 6, 6, 7, 71, 1, 2. How about that?
Yeah, I feel definitely some, like,
Definitely
some little pitch.
5, 6, 4, 5, 3, 4. It's this one here, isn't it?
Mm-hmm. Kind of like the ears, actually.
You don't like your ears?
I like them.
It's a look for the
like
sport.
it's almost
For
like
the
a battle
sport.
scar, yeah.
The battle scar?
The
It
girls
is.
like them, you
It's
know.
definitely a battle scar.
Yeah, girls like them. You know, the girls that like fighters like the ears.
He was #2 in the world in the juniors.
No kidding.
Yeah.
I was #2 in the world like a couple years ago, but I was a juvenile world champ at one point.
Doing
A few
what?
years ago, just this jiu-jitsu stuff. It's
Oh,
like,
jiu-jitsu.
yeah, it's like, it's getting pretty popular. I mean, it has a huge appeal to kids because it helps a lot of kids with bullying and stuff. Because a little kid can beat up a bigger kid with jiu-jitsu, you know, so it helps them out a lot.
Well, what is it mainly? Putting somebody off balance?
No, a lot of it starts actually when you like kind of get on the ground. So you use a lot of wrestling to take people down and stuff, but then when you get on the ground, it's like submissions.
But the Gracies were the real deal.
Well, yeah, the Gracies is
came
the
out-
grandfathers of my sport. Like that's where we all came from.
They came out when there were no rules.
And that's kind of
No
cool. They
rules.
put all
What is that?
That
they
was
did like a
like
no holds barred tournament where all the different martial arts fought each other.
Oh,
And the
wow.
Gracies, which is the jiu-jitsu
they
guys,
beat everybody.
they beat everybody.
And here's the thing: they didn't just fight one guy. in those tournaments, they fought like, 5 guys to win the
Yeah,
tournament.
there's like 5 guys in a night.
Not like in today's time where they just have one fight.
It's crazy.
These guys were like boa constrictors. They would
Yeah.
wrap around somebody and choke them out.
No kidding.
Yeah, that's what we have. We have like, I've had 11,
They never even get
11
hit.
fights in one day before. But I mean, we don't punch and kick, but I've had 11 fights in a day before of like 8 minutes each.
That's
That
a
was
lot.
rough. That's pretty rough.
You gotta be in great shape.
The next day hurts pretty bad. Like, that's for sure.
How did you get on? Where did you go? Abu Dhabi?
Yeah, Abu Dhabi was the furthest, I think. Or Tokyo, I've been to too. Those are
Abu
two
Dhabi,
furthest.
they seem to be doing everything over there.
They're crazy about our sport for some reason. They have like a big, they send us all out there. They just have qualifying tournaments all over the world, and then they pay for the tickets, pay for the airfare, everything.
Abu Dhabi does?
Yeah, all the sheiks or whoever the royal people are, they pay for your,
Good for business.
brings a lot of tourism, I think. Exactly.
Well, how you feeling?
I feel good. I feel kind of like a little release in there. I feel like I can move around a little more.
Okay. All right, now remember the headache if you get it, or vertigo,
Okay.
or ringing. That's all at the top, right here.
Okay.
I didn't do that when I did the one below.
But if I do get that one, that's
If
a
you get
signal.
that,
It's a
yeah.
sign that it's
If you get
easier
any
to
headache like that, one side like that, migraine, that we
One side?
we could take care of it. Like,
Okay.
real quick, just a one shot.
Thank you, doctor.
All right.
I really appreciate it.
All right.
Thank you. Nice to meet you.
Nice to meet you too. Good luck.